Today we're doing a combination procedure on this gentleman. This gentleman is suffering from 3 different complaints that he wants addressed during this operation. One is he's got some gynecomastia, not a lot of gynecomastia, but enough that when he takes his shirt off, it bothers him. And you can see by the roundness of his chest and the amount of tissue that he has in his pectoralis region. The second problem is, although he works out on a regular basis, he's unable, as he's getting older, he's unable to get rid of the extra fatty tissue in the lower abdomen and expose and define his muscles better. The goal of this procedure is high definition liposuction using a tool that is really able to melt the fat away and get really close to the skin, and that's called Vaser. Once we have vasored everything, we're going to allow the skin envelope that he has to be tightened with this device called Renuvion J Plasma. J Plasma does subdermal coagulation. It's designed to create heat in the subdermal region under the skin and create a nice tightening procedure. This device doesn't replace cutting, but allows for a mild to moderate amount of excess skin to be tightened without need of cutting and creating an incision. Ultimately, our goal is to have minimal incisions for our patients, but unfortunately sometimes we have to do incisions in order to be able to get good results. We have just completed a Vaser liposuction high definition on this gentleman, and we also did some fat grafting, and we're going to do some Renuvion to tighten his lower abdominal skin, and then work on his neck to tighten his neck. Thank you for joining us. So in this gentleman, if you pay attention, the lower abdomen has a lot of adiposity, but more importantly than the adiposity and the fatty tissue is the laxity of the lower abdominal wall. And that comes from 2 levels of things. One issue is the fascia, and we can't address the fascia with liposuction. But somebody who can exercise, they can actually tighten the abdominal wall enough